access to medical records then, I've just got a couple of slides on these. So access to a deceased patient record. Now, if PCSE receive a request for access to a deceased patient's GP record from a member of the public, so for example, a family member or next of kin or a third party such as a solicitor, they will be referred to the last registered GP practice. Now, PCSE only process requests for the records of the deceased patients when submitted by the last registered GP practice. So GP practices can apply for the records of deceased patients via the access to requests email address, which is just highlighted there on screen, or you can use our online form, which is on the PCSE website. So PCSE only administer requests for deceased individuals whose last registered GP practice is now closed. So PCSE can only provide a complete copy of records held in storage for the patient. So the Access to Health Records Act 1990 states that the medical records should be reviewed and, if necessary, redacted by the most appropriate health professional before released. Now, in most cases, the appropriate healthcare professional is the most recent GP. Healthcare responsible professional is responsible for deciding whether access should be allowed, which records are appropriate for release, and if any redaction is required. Okay, so access to living patient GP records then. So if PCSE receive a record request for a living patient who are not currently registered with the GP practice, PCSE will process the request in line with the Data Protection Act 2018 because GDPR. These requests are known as subject access requests. Now, if PCSE receive a request from a patient who are currently registered with the GP practice, we'll refer the patient to their current practice. Now, if your practice hasn't received the record of a patient currently registered with your practice, you'll need to submit an urgent medical record request, also known as a UMR, from the PCSE website. And if your practice have received records but the contents are incomplete, you'll need to submit an incomplete record request from the PCSE website. Now, we do sometimes receive requests where we do still have to direct the individuals to the last registered practice. And this is, for example, if the patient's registered, has got incomplete records held by PCSE and a GP, which is also known as awaiting records from the practice. And in cases when we have received a CD, as we are unable to get those records sent on a CD. Now, if you do need to make a subject access request, again, we just ask that you use the online form, as you can see on screen here, and that can be found on the PCSE website, visiting the Contact Us section.